Tuberculosis. TB is defined as an infectious disease caused by Mycobacterium tuberculosis and transmitted through aerosolization. It's characterized by the growth of nodules, the tubercles, in the tissues, especially in the lungs. It is both curable and preventable. There are two types of TB, latent and active. For latent, tuberculin skin test is going to be positive. You're going to have a normal chest x-ray, a negative sputum culture, no symptoms, it's not infectious, and it's not defined as an actual TB case. With an active TB in the lungs, you're going to have a positive skin test. It's going to show white lesions in the chest x-ray, a positive sputum culture. You're going to have all of the signs and symptoms of active tuberculosis, such as cough, fever, and weight loss. It's often infectious before treatment, and this is defined as an actual TB case. Tuberculosis is transmitted from persons to persons through the air. So for an example, when an affected person sings, speaks, and or coughs, or simply talks to a person, the TB bacteria becomes lighter in weight due to the water loss, and this bacteria is several microns in size, and it's the moisture in the mucus. So simply talking to someone, sneezing and coughing, and being around a person who has TB, it can be passed easily. The healthy person will not become infected if the TB bacteria are destroyed inside the nasal passages or through the throat, which you can see in the photo. It actually has to go down into the lungs for it to infect someone with TB. So risk factors. The vulnerable population often have health conditions that are exacerbated by unnecessarily inadequate health care, so such as older and homeless populations, lower socioeconomic status, foreign immigrants, HIV positive patients. These people are not able to get the adequate health care they need and to doctor's visits or the treatment they need for other diseases, which puts them at a higher risk to develop tuberculosis. HIV is the main cause of death in HIV positive patients from low resource settings, so not having the adequate treatment or being immunocompressed. Those in frequent contacts with untreated persons, so simply being around someone who has TB is going to put you at a higher risk. Living in overcrowded living conditions, so those who resided in better housing environments had a 4.35 times lower risk of developing TB, and then children who completed primary education had 3.2 times lower risk of developing childhood tuberculosis. Signs and symptoms. This includes a cough, which can be bloody and have bloody sputum, a positive sputum culture for acid-fast bacillus, low-grade fever with night sweats, anorexia, weight loss, malaise, and fatigue. The fever with night sweats, anorexia, weight loss, and fatigue are the first indicators of active tuberculosis. Incidence and prevalence statistics. 1/4 of the world's population is infected with tuberculosis. It's the leading killer of people who are HIV infected. 2.9 cases per 100,000 persons were reported in the United States in 2016, which is a 3.6% decrease from 2015. And here is a link to the CDC, which actually shows a map of the United States, and you can scroll your cursor over the states and see the incidence of TB in these states. And you can see that the states with overpopulation, such as Texas, Florida, and California, all have a higher incidence of developing tuberculosis compared to other states. Demographics. One of the top 10 causes of death worldwide is tuberculosis. In 2016, out of 10.4 million people who fell ill with TB, 1.7 million died. Leading countries with infected TB status are India, Indonesia, China, Philippines, Pakistan, Nigeria, and South Africa. And over 95% of TB deaths occur in low and middle income countries. So diagnostic testing, the Mantox PPD skin test is the skin test you'll get when you go to the doctor to be tested for TB, which is usually required before entering any healthcare profession. This is a test that tests for immunity by an intradermal injection of tuberculin. They'll actually inject you with the tuberculin, and 48 to 72 hours you'll go back to test, and there will be a bump if you have active tuberculosis. Although with latent and active tuberculosis, the skin test will come back positive for further testing if there are no symptoms. To confirm the diagnosis, you'll use a sputum culture, serum analysis, or a chest x-ray. And in the chest x-ray, it'll show a whited out portion of nodules, which will confirm the diagnosis of TB. Treatment and management, combination drug therapy for 6 to 12 months as directed. Patients must follow all infection control measures. So make sure they stay away from people in the community, and if they go out, to wear a mask. Ensure medication compliance and follow-up care, which is really important because some TB bacteria are naturally resistant to one or more drugs. So following up with your doctor to ensure that antibiotics and other medications are working is important. And then the epidemiology. In applying this to epidemiology, researchers are using randomized controlled trials in areas with a high prevalence of TB. Doing so, they can see what causes these areas to be such a high risk factor and figure out how they can change the treatment and management of tuberculosis in underdeveloped countries without a lot of medical resources. Most places aren't able to have proper screenings for people to get the correct treatment, which causes TB to spread irrationally.